Hello, I'm Lawrence Fishburne. A pioneer is defined as a trailblazer, someone who develops a new way of doing things. Nowhere is this truer than in the field of healthcare. Every medical advancement starts with a pioneer who explores and digs deep in the name of science. Here's one such story.
Our nation's hospitals, they're designed and staffed to be places of hope and healing, but can often be some of the most dangerous places on the planet. According to the Centers for Disease Control, 1.7 million people contract an infection from a U.S. hospital every year, and over 80,000 people will die from that infection.
We believe that hospitals should be designed for zero, meaning they should have a goal of zero infections and zero harm. HAI stands for Healthcare Acquired Infection, and one major contributor is the sheer amount of contamination in the space. And that's mostly due to all of the contamination that comes in with the doctors into the room. People ask me all the time, why hasn't the healthcare industry done more to fix this problem? Well, it comes down to money. Until 2009, the federal government was actually paying for the treatment of these infections, so they didn't have any incentive to do anything different. But now hospitals are responsible for the cost of that treatment, and it's estimated to be somewhere around $35 billion a year.
Nearly 20,000 people die each year from an infection contracted during surgery. And while other industries have very tight standards for aerobiological quality, astoundingly, there are no clean air standards in the U.S. for a hospital operating room.
The current requirements in the guidelines that are used for designing and constructing an operating room are not all evidence-based. In fact, they are more prescriptive than performance-based. Hospital groups need to become increasingly committed to providing performance measures to create the optimal environment for the patient and the staff. The key to achieving these improved outcomes begins with understanding how your operating room is performing. Monitoring the critical environmental factors that would otherwise be undetectable allows for optimal aseptic performance of the room. There needs to be a strict set of performance criteria that should be met by every hospital seeking to qualify as a designed for zero facility.
With healthcare harm such a major issue in the U.S. and around the world, the climate towards combating infections is changing within the industry, and hospital groups are now looking to their equipment vendors for solutions. Believing that hospitals should be designed for zero infections and zero harm, these contamination control systems are designed to treat hospital operating rooms like clean rooms, where the sterilization of space is paramount.
We've been able to take what we've learned from over 30 years of building clean room air delivery systems, and now we can apply that technology to the design of a hospital operating room. Zonal pressure control is an example. That allows for the efficient movement and capture of these contaminants and keeps that contamination from getting into the surgical site. And this system provides for the control of pressure and flow in the space, so no particles are inadvertently introduced into the surgical site, which could lead to an infection. The system then employs disinfecting technology that's specifically designed to kill the pathogens in the room. And this is a new method, and this has been proven now to reduce infections by 73%.
In addition to fully integrated prefabricated solutions by SLD technology, other industry leaders have developed technologies that detect microbial contamination and infection like never before.
The University of Iowa works with RDB Bioinformatics, the maker of PathTrack. We design clinical trials that compare operating rooms to find the best designs and systems to help achieve zero infections. The PathTrack system follows the patient from home to the hospital, into the operating room, to the recovery room, to the ward, and then to home. PathTrack monitors the microbial load that the patient are exposed to throughout the process. This gives the hospital much more data that they currently have regarding infection control and the environment. The PathTrack system can help hospitals looking to achieve a design for zero status.
Surgical site infections are one of the most dreaded complications for both the medical community and the patients. Results in patients being readmitted to hospital, undergoing additional surgical procedures requiring antibiotic treatment, with all the unintended side effects of antibiotics, etc. And it leads to mortality. Patients die from infections. There have been huge efforts in the recent decade or so, both by CDC and other organizations, to try to get our arms around this issue. And Design for Zero concept is a very novel and incredibly important initiative. We've been very fortunate to have the technological know-how of Design for Zero and the clinical input from the PSI, Paravisy Surgical Innovation, come together to design a protocol an algorithm that will allow us to implement strategies that will reduce the incidence of infection, possibly allow us to diagnose the problem earlier with more accuracy, and then implement effective treatment strategies that will reduce the burden, both psychological and economic, of this problem, namely surgical site infection.
We need better dialogue and collaboration to help design the best path forward. And the general public also needs to become more aware of this issue so that change can be demanded, both from the healthcare industry and the healthcare-related legislation and guidelines. A hospital whose goal is to achieve zero infections, i.e. designed for zero, allows patients to know that they are in the best possible facility and will receive the best possible care.
There's an opportunity for substantial change in the healthcare industry right now. However, that change may not happen if the public isn't aware of the problem and driven to action by a unifying message. That's why the Design for Zero movement is so important.
By coupling efficient sterilization of the operating room with advances in airflow technology, it may be more possible than ever to achieve an infection rate of zero.
Today's advances give us hope for a healthier tomorrow. Thank you for joining us. I'm Lawrence Fishburne.